Kristen Ahern. I'm a student nurse at HCC, and I'm going to be doing a routine head-to-toe assessment on a patient. First thing I'm going to go do is get my patient in the waiting room. Hi, is Megan here?
Hi.
Hi Megan, how are you?
Good.
Come on in. I just have your chart over here. Could you let me know that that's your name, address, and phone number, and date of birth?
That's right.
Great. So, I'm going to have you sit down. What time was your appointment today?
It was at 1.
Oh, I'm sorry, we're running just a little bit late today. And you're here for?
Physical.
Physical for? Okay. The patient walked in. She was alert and oriented. She knew her name. She responded to her name. She also could read written word when I showed her to verify her information on the chart. She had a steady gait when she walked in. Her balance was good, and we're making eye contact as we speak. Her hand, when I shook her hand, was warm. Her skin was intact, and from the skin that I can see, everything seems to be intact. Things that would concern me while doing a skin assessment would be things like breaks in the skin, rashes, if there was any cyanosis, signs of bluing, scars, if there was any sort of cuts or wounds with drainage, maybe moles that might look like they are having trouble, stuff like that. So when I go through my whole assessment, I'll be checking each area of the body and checking those things on each part of the skin. So first I'm going to start with checking my patient's scalp. I'm just going to look in the hair and on the skin of the scalp to see if there's any signs of any openings or lesions, to see if the scalp is red. I don't see any dandruff or psoriasis, which is great. I'm going to move to her ears, checking the outside skin on the ears. It looks good, no redness. There's no drainage in the ears, and the inside of her ears aren't red. No drainage, no bleeding. That's great. Again, I'm going to look for the same thing in your nose. And there's no bleeding, no redness. The nares are intact in her nose. And I'll have you open your mouth for me and wiggle your tongue back and forth. Mucosa is moist. Her tongue is pink. She's got good strength back and forth in her tongue that shows me no signs of any neurological trouble. I'm going to feel her neck for any swelling in the glands. Is there any pain with that?
No.
All right. So next I'm going to be checking your pupils and we'll check your eyes. Okay, I'm going to dim the lights. So I'm just going to pass the pen across each eye, all right? Just look straight ahead. When I shine the light in the patient's eyes, her pupils constrict, and when I take the light away, her pupils dilate. That's good. So now I'm going to have you look straight at the pen. This is testing for accommodation. Her pupils constrict when the pen is close to her face, and they dilate again when I take the pen away. And I'm going to have you follow this pen with your eyes only, not your head, all right? I'm checking for the patient's extraocular motion and making sure that she can see in all frames, which she's done very well. Great, thank you. So the next thing that I'm going to check for with you is to see your range of motion, your strength. So are you having any pain at the time?
No.
All right. So the first thing that I'm going to do is have you bend your arms at your elbows as if you were lifting weights. Now just do your wrists. Back and forth and up and down. Can you open your fingers and close them for me? Great. And can you raise your arms and come down in a circular motion like this? Maybe one more time. No pain with that, right?
No.
Okay, now I'm going to test. She's got great range of motion in all of the joints in her upper extremities. Now I'm going to test the strength in her upper arms. Place your hands out like this. I'm going to push down against you to push up when I push down. Great. Now let's do opposite. Great. Equally strong bilaterally. She had a good force against me. So now I'm going to also do the same thing down here. I'm going to have you just lift this knee against my pressure of my hand. Great. And I'm going to have you lift this knee against the pressure of my hand. Bilateral strength in her thighs, which is great. I'm going to hold against your calf and just try to kick out against me. Great. And I'm going to hold against your calf and have you kick out against me. Awesome. And now can you lift, push against my toe, push your hand against, your toe against my hand, excuse me, and then push down, push up, and push down. No trouble doing any of that, right? I'm going to look at her legs while I'm down here, look at the skin. I'm also checking for any edema, which I don't see any in either leg, which is great. The skin coloration is good. While I'm down here, her shoes would not be on. I would have her wiggle her toes to make sure she's got dexterity in her digits, and I'm also going to check capillary refill, and I'm going to check her pedal pulse on both sides to make sure they're both present and strong, equally strong and present. I'm going to go back up and have her, I'm going to cross my hands and I'm going to have you squeeze my fingers. That shows strength. And can you also just move your legs out back and forth for me? And then move your ankles up and down like a gas pedal. She's got full range of motion in all of her extremities in the lower. I'm going to squeeze her fingertip and just checking for the capillary refill. She's got good circulation in both hands. I should also check at this point for her femoral pulse in her leg. I'm going to check for her brachial pulse here. And I'm going to check for her radial pulse. I should have, at the beginning of my assessment, checked for her radial pulse for a full minute. I also checked her blood pressure when she came in, which was 120/80, which is in the normal range. And while I was taking her pulse, I also noted her respirations, which were 14, which falls in between the 12 to 20 normal range. Her pulse was 60, which is another normal sign, so she seems like she's in perfectly good health. So now my patient has changed into a Johnny with an open back. I'm going to be checking now her spine. So I'm going to go ahead and have you stand up for me and just face that way. And you don't have to touch your toes, but bend over as if you were going to be touching your toes. I'm going to be assessing up and down her spine and palpating up her spine. I'm checking for any abnormal curvature, any lumps or masses or bony prominences that may not be normal. I'm checking also for scoliosis, lordosis, and kyphosis, some different problems with the spine. I'm going to be checking her scapula on either side and make sure that they're evenly placed bilaterally. And I'm also going to check her hips and make sure that they're lined up and that they're appropriately in place and that one's not higher than the other. Checking her skin again at the same time for all the things that I was saying before, any lesions, rashes, anything that might be of concern on the skin all over her back. Okay, you can go ahead and stand up for me. So at this point, I'm going to have you sit down. I'm going to be listening to your heart and your lungs now, so I'm going to be doing that underneath your Johnny, touching your skin. Is there any cultural reasons why you wouldn't want me to be touching you with my hands? You're okay with that? All right. So first I'm going to come over, and again I'm not going to be over clothing, I'm going to be under clothing, and I'm not going to be listening to her lungs on the bone either. So I'm going to be looking in the back between the first intercostal space, the third intercostal space, the fifth and seventh and the ninth, equally on both sides. Again, I wouldn't be over her shirt doing this. And I'm going to have you just take some deep breaths in and out while I'm doing this. Good. Keep breathing in and out. In and out. Nice and deep. Great. They sound great. And over on this side, deep breath in and out. I'm going to check her lateral. It's going to be in between the second intercostal space, the fourth, and the sixth on both sides. Good. And again on the other side. Alright, and I'm coming to the front. I'm going to be starting at our upper clavicular area and moving down into the second intercostal space. Second over here. And I missed this side, so I'm going to make sure I get this clavicular side as well. Coming down to the fourth. And the sixth is down. Alright, sounds great. Her lung sounds sound good. The airways and the breathing sounds in her upper airways should sound a bit like breathing through a paper towel roll, and then down deeper it's going to sort of sound like a breeze or wind passing through trees. Next, I'm going to be looking at the checking heart sounds at the 5 cardiac points. First I'm going to be looking at her, listening to her aortic, which is on the left sternal border over here. Excuse me, right sternal border, the only one on the right sternal border. I'm going to move over to the pulmonic, which is over in the second intercostal space. Again, I'm listening through the bones, not on top of bone. I'm going to move down to Erb's point, which is about located in like the third intercostal space. The tricuspid is down in the fourth intercostal space. I'm going to have to raise her, and I'm going to listen there. And then also, here is the mitral. It's the apex of the heart. We're going to listen here for a full minute. And all of those sound great. Alright, so the next thing that I'm going to be doing is checking your abdomen. So I'm going to have you just lay down for me on the table, get comfortable. And again, I would not be doing this over clothing. I'd be doing it on bare skin. I'm going to be checking first. I'm going to auscultate before I palpate for bowel sounds, positive in all 4 quadrants of her stomach. I'm going to start in the lower right. I'm going to be listening for a full minute, and if I don't hear bowel sounds in any of the quadrants, I'm going to want to stay in that quadrant and listen for a full 5 minutes. She's positive bowel sounds in all 4 quadrants. Her belly, I'm going to palpate her stomach. Her abdomen is soft. She's not distended. I don't feel any obstruction anywhere. Do you feel any pain anywhere while I'm touching your stomach? Alright, I'm also going to check and assess her bladder. You're going to feel a little pressure on your bladder. So I'm feeling the bladder. It's in place. It's not distended. Nothing's hard. Can I ask you, do you have frequent urination? Is everything fine with your urination? No pain, burning? Regular? How about, you can actually have a seat and sit back up. With your as far as bowel eliminations go, are those normal? You have a pretty healthy diet, and anything that, any special cardiac diet or diabetes or anything like that?
No, just healthy food.
Drinking plenty of water,
Yes.
and so your eliminations are normal?
Yes.
All right. I'm just going to go over a couple more points with you. If we could just have a little discussion. Do you feel like you're getting enough sleep?
Yeah.
At night, yeah. And do you take any sleep aids
No,
for
I
sleep? Let's see. Are there any glasses or hearing aids that you wear? Do you need a prescription changed or any consults made? Are you sexually active?
I am.
You are more than one partner, or?
No.
And are you using any kind of contraceptives? Condoms, so you know that those also protect you against, they're not 100%, but they do protect you against STDs as well. Are you doing self-breast exams at home? You know the risks. All right, Megan, well that concludes our assessment. I hope you have a great time and good luck at your new job.
Thank you.
So that was a typical head-to-toe assessment. All of my findings were basically what we should find in a normal, healthy person. There was nothing that really was any cause of concern to me. My patient was alert, oriented, ×4. She was dressed appropriately for the weather. She showed no signs of distress. She had appropriate height for her weight. She didn't have any odor. There was nothing to me that was any sort of concern. So that is a typical healthy person is what we'd be looking for.